Thank you very much, Chipa-san, and good morning, everyone. My name is Naoki Hayakawa from Japan. I'm very happy to be here. My presentation title is about minimize the contrast in vascular treatment. At first, in vascular therapy, firstly, a patient with CKD can be problematic because of the risk of CN, as you know. Various methods for preventing CN have been reported. However, there are no consensus. So we usually use the carbon dioxide angiography or a device-guided approach. However, they have their own weak points, such as the complications and the imaging quality. So now we made a digital subtraction angiography program with a specialized diluted contrast, and we named this method low concentration DSA and LC-DSA. This is the concept of LC-DSA. We adjusted the DSA parameters like this, a very high contrast and low edge gain because of the noise reduction. And this is a protocol, and we use 10% diluted contrast, as that is almost equivalent to the CO2 angiography. And we injected manually about 5 to 10 milliliters contrast. This is a static image. We could get acceptable imaging with a small contrast medium. So this is a case, 70-year-old male, severe claudication of his left leg. He had a CKD, and pre-EGFR was about 40. And this is a pre-angiography by diluted contrast. The CTO was SFA distal to P3 segment, and each DSA shot needed under 1 milliliter of contrast medium. However, we could see main vessels and small carotid channels and connections well, like this. So at first, we performed the antigrade wiring with O14 guide wire. However, CT was very hard, so antigrade approach was very difficult. So next, we are switching to retrograde wiring. We chose these carotid channels, and we performed transcarotid approach by Regalia guide wire. Like this, this is a roadmap by LC-DSA, and this is a tip injection. CT was blunt type, very hard. So we use a hard 40-gram tapered wire, and finally we could achieve the landable in the CTO region. And next we recross to the ATA from antigrade, and we could achieve the all intraluminal wiring. After that, the balloon angioplasty, the scoring balloon, and the kissing balloon dilatation, and finally long balloon with a long inflection time. So this is the final angiography. There were no residual stenosis, and there were no major dissection, as you can see. Moreover, we could identify the distal BTK and below the ankle vessel well. And the contrast medium was under 30 milliliters, even if this complicated procedure. Clinical cost was very good. Discussion, this is a comparison of normal DSA and normal DSA with dilated 10% contrast. And this method, this image is our LC-DSA imaging. And we could get acceptable imaging with a very small amount of contrast. And this is a comparison with CO2 angiography in the same patient. And imaging quality was better than CO2 DSA, which is better. So in this year, we published about this, this procedure. We analyzed the 63 LC-DSA patients and the 59 control patients. And the CN was 0%, and the total contrast medium was dramatically reduced. So the dilated contrast angioplasty, the efficacy is a small amount of contrast medium, and sufficient quality of angiography. And the safety, there were no complications, and CIN rate was very low, and we don't need any special technique and devices. So we can perform EVT for CKD patients without lowering quality. So this is my conclusion. We experienced very tough case using diluted contrast angiography, and LC-DSA has a possibility of being useful for treating CKD patients. Thank you for your kind attention.
Thank you. And thank you for staying on time. So this is very important and very interesting. So let me see if I understand it right. You're using 10% diluted contrast, and then the thing you change in the actually digital subtraction picture is you go 1 frame per second. Is that the protocol?
Frame was 3 per second.
3 frames per
Three
second.
frame per second.
So, and the normal digital subtraction you showed in the middle with diluted contrast was how many frames per second?
Almost same. Diluted contrast 3 frame, and the normal was 1.
Okay. So it's not only diluting the contrast, but also changing the setting on the X-ray that you see so much.
Yeah.
Perfect.
This contrast setting is almost equivalent to CO2 DSA setting. Yeah.
Do you see any significant change in radiation dose with your
Yeah.
change in?
Thank you very much. Very nice suggestion. Radiation dose is slightly higher in digital angiography, but newest angiography machine by Philips or Canon can reduce radiation dose. So I think it is no problem.
But the significant reduction in the contrast dose, I think, was from 117 to 30 cc's for a limb. That's excellent. Any questions from the audience? We'd love to hear from you guys if you have any comments or questions. Any other comments? All right. Well, thank you very much.
Thank you very much.
Excellent.